Blood culture collection from a central venous catheter. Review Lippincott procedure for blood culture collection from central venous access catheter. Ensure the type of catheter is identified and that there are blood culture orders for each lumen of the CVC and for peripheral blood cultures if needed. Gather supplies. Collect blood culture bottles, one for each lumen, and check the expiration date to ensure the bottles are not expired. 20 ml syringe for each lumen. 2 10 ml syringes of normal saline for each lumen. A new cap or needleless connector for each lumen. A needleless transfer device for each set of blood cultures. Alcohol or CHG swabs. A mask with a face shield for the RN. A mask for the patient and one for anyone in close vicinity. A biohazard bag for each blood culture set. Log into Soft ID. Scan patient armband or an ambulatory setting, the patient arrival notification or PAN sheet. Click Print Labels. Use the arrow to navigate to the first set of blood cultures. Ensure the catheter type is correct. Modify if necessary by selecting the line type. Under Selected Site, delete the word blood. Click Modify, then select the lumen color, for example, red lumen. Second, select the site or location, example, subclavian right. Use the arrow to navigate to the next set of blood cultures. Ensure the catheter type is correct. Modify if necessary. Under Selected Site, delete the word blood. First select the lumen color and then select the site or location. Click Save and proceed to the Print Label screen. Print all blood culture labels. Review all the labels to ensure the source site is printed correctly for each set. Ensure that 2 labels for each lumen, and at this point, if it is wrong, cancel and restart from the scanning of the armband. Discard any labels not to be collected by the RN, for example, peripheral blood draws done by lab. If you are having a second assistant, click the alternate phleb and either have them scan their badge or enter their ID number. Clean bedside table with Oxivir and let dry. Stop all infusions for 2 minutes prior to the collection if applicable. For assistance with setup, you can use the CVC Blood Culture Setup Guide. This is found on the Learning Library under Blood Cultures. Gather all your supplies and place them on the clean, dry bedside table. Often it is helpful to have that second RM to help when drawing your blood cultures. Use the blood culture guide to help with setup for the bottles and the labels. Remembering we fill the blue top before the purple top. If not already done, stop all infusions for at least 2 minutes prior to the draw. Clean the diaphragm tops of the blood culture bottles with alcohol or CHG swabs. 1 swab per bottle top. Make sure the swab diaphragms are dry before you add blood to the bottle. Apply mask and face shield. Apply face mask to the patient and anyone in close proximity. Perform hand hygiene and place a clean pair of gloves. To begin the setup, you need to take the 20 milliliter syringe and add a new needleless cap connector. This needleless cap connector is what you will draw your blood cultures through, and it will remain on the CVC. Repeat this procedure on each 20 milliliter syringe, 1 per lumen. Clamp the catheter as applicable and remove the needleless connector cap and complete a 50-second alcohol or CHG scrub of the lumen end. Connect the cap on the empty syringe to the lumen. When the 20 milliliters of blood is drawn, you will fill the blood culture bottles. If you have an assistant, they can help with filling the bottles. Add the needleless transfer device to the syringe. Carefully inject the blood into each blood culture bottle, remembering the blue top before the purple. Divide the blood between the 2 bottles, 10 mL per bottle. Carefully look at the markings on the syringe to ensure no more than 10 milliliters is instilled into the bottles. Gently invert the bottle 8 to 10 times after the blood is instilled. Flush the lumen with normal saline 10 to 20 mL using the push-pause method. This is to clear the line of the blood. When your first set of cultures is complete, label each bottle with the correct lumen color labels in front of the patient. Complete the first set before you start drawing your next lumen for blood cultures. When labeling the blood culture bottle, be careful not to cover any barcode on the bottle. Place the label in a clear space. Place the label so when you hold the bottle in your left hand, you will clearly read the label from left to right. Once all blood cultures are drawn, scan the first bottle. Then scan all remaining bottles. This does not need to be in any particular order. Immediately then scan the patient armband or the pan to complete the collection. If you get a pop-up screen, do not click the back button because you will cancel the collection and the process will need to start over again from scanning the patient. To complete this process at this stage, scan the patient armband or pan and it will complete the collection, which closes the loop. When drawing 3 culture bottles, the order is blue, purple, blue. 30 milliliters of blood is needed and will be drawn in one 30 ml syringe per lumen. Using a needleless transfer device, you will instill 10 milliliters into each of the bottles. Carefully watch the lines on the syringe to ensure no more than 10 ml is going into the blood culture bottle. Gently invert the blood culture bottles 8 to 10 times. So 10 milliliters into the blue bottle, 10 milliliters into the purple bottle, then 10 milliliters into the blue bottle. Flush the lumen with normal saline 10 to 20 ml using the push-pause method. This is to clear the line of blood. When the first set of blood cultures is complete, label each bottle with the correct lumen color labels. For example, if you drew blood from the red lumen, you would use those labels on the 3 culture bottles. Complete the first set before starting your second set. When labeling the blood culture bottles, be careful not to cover any barcode on the bottle. Place the label in a clear space. Place the label so when you hold the top of the blood culture bottle in your left hand, you will clearly read the label from left to right. When complete, continue to your next lumen culture set.